Welcome to the lecture, Culture and Health. Today's lecture will discuss what culture is and how it's related to health. We will discuss several concepts from anthropology that are critical for understanding how health and culture are related. We will also discuss various cultural views of health, illness, and healers, both traditional and non-traditional. Before we begin, however, it's important to discuss and define culture. Culture is defined as the full range of human behavior patterns. It encompasses the values, beliefs, norms, and material objects that form a people's way of life. In sum, it can be described as a blueprint for living. It is a person's way of life and shapes what that person does, as well as helps form a person's personality. Generally, culture is believed to consist of three layers: cultural traditions, subculture, and cultural universals. The first layer, cultural traditions, are the shared language, traditions, and beliefs that set each group of people apart from others. Cultural traditions are acquired during a person's lifetime, usually from parents or other family members. For example, when people speak of Italian or Japanese culture, they are referring to the shared language, traditions, and beliefs that set each of these people apart from others. In most cases, those who share your culture do so because they acquired it as they were raised by parents and other family members who have it. Layer 2 is known as the subculture layer. In complex, diverse societies in which people have come from many different parts of the world, they often retain much of their original cultural traditions. As a result, they are likely to be part of an identifiable subculture in their new society. The shared cultural traits of subcultures set them apart from the rest of their society. Examples of easily identifiable subcultures in the United States include ethnic groups such as Vietnamese Americans, African Americans, and Mexican Americans. Members of each of these subcultures share a common identity, food tradition, dialect or language, and other cultural traits that come from their common ancestral background and experience. As the cultural differences between members of a subculture and the dominant national culture blur and eventually disappear, the subculture ceases to exist except as a group of people who claim a common ancestry. That is generally the case with German Americans and Irish Americans in the United States today. Most of them identify themselves as Americans first. They also see themselves as being part of the cultural mainstream of the nation. The third and final layer is cultural universals. These are learned behavior patterns shared by all of humanity collectively. Some examples include communicating with verbal language. With few exceptions, most people in the world just naturally understand that the accepted way to communicate is through talking. Other cultural universals include using age and gender to classify people, the sexual division of labor, men's work versus women's work, and distinguishing between good and bad behavior. So why is culture important to health? There are four main reasons. First, culture is closely related to health behaviors. Diet is a perfect example. Different cultures eat different foods. Some diets could be seen as more healthy than others. Those who eat white rice with every meal, which is high carb and not seen as very healthy, should have a more rounded diet. But oftentimes diet is a part of culture. Second, culture is an important determinant of people's perceptions of illness. Different cultural groups will have different perceptions on what is considered good and what is considered bad health. For example, mental illness is seen differently by various cultures. Some don't recognize the concept of mental illness at all. Third, the extent to which people use health services is linked to culture. Some groups may see a practitioner as soon as they start to feel ill, and others may visit a practitioner only when they are very sick. Fourth, different cultures have different practices concerning health and medical treatment. One example is traditional Chinese medicine. This consists of herbal medicine, massage, acupuncture, and other alternative medical treatments. To understand the cultural context of health, it is essential to work with several key concepts. These concepts include the insider versus the outsider perspective, the idea of illness versus disease, the terms ethnocentrism and cultural relativism, and holism. We will discuss all of these on the following slides. First, the concepts of insider and outsider perspectives are useful for examining when we are seeing things from our point of view and when we are trying to understand someone else's view of things. The insider perspective, or emic in anthropological terminology, shows the culture as viewed from within. It refers to the meaning that people attach to things from their own cultural perspective. For example, some cultures view worms in children as normal and believe they are caused by eating sweets. The outsider perspective, or etic in anthropological terminology, refers to the same thing as seen from the outside. Rather than the meaning, it conveys a structural approach, or something is seen without understanding its meaning for a culture. It can also convey an outsider's meaning attached to the same phenomenon. For example, that worms in children are contracted through ingesting eggs found in contaminated soil or in foods contaminated by contact with that soil. The concepts of insider and outsider perspectives allow us to look at health, illness, and prevention and treatment systems from several perspectives, to analyze the difference between these perspectives, and to develop approaches that will work within a cultural context. The next important concept is that of illness versus disease. Contrary to popular belief, they are not the same thing. Illness is a personal, interpersonal, and cultural reaction to disease or discomfort. It is the emic, or insider view, of a health condition. It is often highly subjective. Sometimes a person may feel like she or he has an illness and can describe the symptoms and condition, but there may not be a name for it in that person's culture. A disease, on the other hand, is a physiological condition and is associated with the etic, or outsider view, of a health condition. Disease is simply a deviation from some pre-established standard norm. Most high-income countries follow the Western medical paradigm in explaining causes of disease, while many people from low and middle-income countries see illness caused by factors other than disease. It is possible to have an undesirable deviation from a Western biomedical norm and to feel completely fine. Hypertension, early stages of cancer, HIV infection, and early stages of diabetes are all instances where people may feel well but have a disease. On the flip side, it is also possible for someone to feel ill and for the Western biomedical system not to identify a disease. When this occurs, there is a tendency for Western-trained healthcare providers to say that nothing is wrong or that it is a psychosomatic problem. Psychosomatic means essentially an illness that is caused or aggravated by a mental factor. Although both of these can be the case, there are several other explanations for this occurrence. One possibility is that Western biomedical science has not yet figured out how to measure something. Recent examples of this include anxiety attacks and chronic fatigue syndrome. Both of these were labeled psychosomatic at one time and now have measurable deviations from a biological norm. Another possibility might be that the condition is something called a culture-bound syndrome, which we will discuss in a later slide. The important thing to remember is that illness perceptions vary across cultures. What some cultures view as normal may be seen as an affliction in another. I'm going to read you a brief excerpt from a New York Times article series about culture and health to illustrate this. Roberto Luis Fernandez was a young doctor in training in Massachusetts when he encountered a patient who was 49 and suicidal at Cambridge Hospital. The Puerto Rican woman begged for help in resolving a conflict with her son, but the Harvard University-affiliated psychiatrists focused on one set of symptoms. She was hearing voices, seeing darting shadows, and sensing invisible presences. They diagnosed her as depressed and psychotic, or out of touch with reality, and medicated her. She was discharged. Soon after, the woman had an argument with her son and nearly killed herself by overdosing on the medication. For Luis Fernandez, who is Puerto Rican, the suicide attempt confirmed his fears that his superiors had misjudged the situation. For months, as top psychiatrists ordered him to keep increasing the potency of her drugs, he had told himself that hearing voices, seeing shadows, and sensing presences is considered normal in some Latino communities. But he dared not challenge the wisdom of the medical model. "I wasn't sure if she was psychotic, but I treated her as if she was," he said about the case, which he wrote up in a medical journal. "I gave her the medicines." When the hospital's outpatient unit evaluated the woman anew, doctors there came up with a different diagnosis. They concluded that her symptoms were not abnormal in the context of her culture. They were expressions of distress, not illness. Luis Fernandez helped her reconcile with her son. She still heard voices and saw shadows, but now, as before, they did not bother her. This is an example of the importance of providing culturally competent care. What we may view in our culture as abnormal may actually be quite normal in another culture. Now we move on to the concepts of ethnocentrism and cultural relativism. Ethnocentrism is seeing your own culture as best. It is a natural tendency because the survival and perpetuation of a culture depend on teaching children to accept it and on its members feeling that it is a good thing. In the context of cross-cultural understanding, ethnocentrism poses a barrier if people approach a culture with the attitude that it is inferior. Cultural relativism refers to the idea that each culture has developed its own way of solving problems, such as how to live together, how to obtain the essentials of life, such as food and shelter, and to explain phenomena. No one way is viewed as better or worse, they're just different. This works well for classic anthropology, but poses a challenge when global health is considered. What if a behavior is wrong from a public health perspective? How does one distinguish between dangerous behaviors, such as using an HIV-contaminated needle, swimming in a river with snails known to carry disease, or ingesting a powder with lead in it as part of a healing ritual, and behaviors that are merely different and therefore seem odd? It is important to strike a delicate balance between being judgmental for no good reason and introducing behavior change because there is real harm from existing behaviors. In general, it is best to leave harmless practices alone and focus on understanding and changing harmful behaviors. This is harder than it seems because the concept of cultural relativism also applies to perceptions of quality of life. For instance, cultures that believe in reincarnation may approach death with acceptance and may not adopt drastic procedures that only briefly prolong life. In some cultures, loss of a body organ is viewed as impeding the ability to go to an afterlife or the next life, and surgery may be refused. It is important in global health for cultural outsiders to be cautious about statements regarding what is good for someone else. The concept of holism is also useful in looking at health and disease cross-culturally. Holism is an approach used by anthropologists that looks at the broad context of whatever phenomenon is being studied. Holism involves staying alert for unexpected influences, because you never know what may have a bearing on the program you are trying to implement. For public health, this is crucial because there may be diverse factors influencing health and health behavior. We will continue this lecture in part 2.